In this video, you will learn about what is blood pressure. You will come to know about types and stages of blood pressure and normal ranges of blood pressure. What is blood pressure? The amount of pressure your blood applies to push through your arteries is called blood pressure. The heart uses force when it pumps to propel oxygen-rich blood into your arteries. The arteries deliver it to the tissues and cells of your body. Your heart pumps blood into the arteries that carry it throughout your body each time it beats. This occurs 60 to 100 times each minute, every single day. It's crucial to keep in mind that a normal pulse can differ from person to person and that your age and general health can also affect your pulse rate. Your entire body receives oxygen and nutrients through your arteries so that it can function. Heartbeat versus blood pressure. Each of them involves your heart, yet they are separate terms. The force with which your blood flows through your blood vessels is measured as blood pressure. The amount of times your heart beats in a minute is known as the heart rate. An increase in heart rate does not mean that your blood pressure is high. Using a blood pressure cuff and gauge, you can determine your blood pressure. Types of blood pressure. Systolic blood pressure. The heart pumps blood into the arteries each time it beats. The pressure that builds up in the arteries while the heart beats are measured as systolic pressure. Systole, the name for this stage, is when blood pressure is highest. When the reading of the systolic blood pressure is less than 120 millimeters of mercury, while a person is sitting still and at rest, the blood pressure is regarded as normal. The most common reason for high systolic blood pressure is the stiffening of the arteries, which makes the heart work harder to pump blood through them. High systolic blood pressure. There are various stages even in the high systolic pressure range. Stage 1 hypertension. Stage 1 hypertension is defined as a systolic blood pressure of 130 to 139, which can be treated with short-term medications and dietary modifications. Stage 2 hypertension. Systolic blood pressure of 140 or greater is considered stage 2 hypertension, which can significantly raise the risk of a heart attack or stroke and may necessitate a lengthy treatment regimen. Hypertensive crisis. If your systolic blood pressure is 180 or above, you are in a hypertensive crisis and need to contact your doctor immediately. Low systolic blood pressure. Hypotension. Yet, there can be a point where the systolic pressure is too low. Hypotension is the term used when the value is much lower than 90 millimeters of mercury. This might make you feel faint, woozy, or lightheaded. If low blood pressure is not addressed, it could lead to the kidneys and other organs starting to shut down. Systolic hypotension might develop if your blood volume is too low. For instance, having extensive bleeding or being excessively dehydrated might both result in low blood pressure. Simply put, there isn't enough blood to move through the body in these circumstances. Moreover, low blood pressure can occur if the heart muscle is too weak to push blood correctly, such as in the case of heart muscle disease, cardiomyopathy, or excessively widening arteries, as in vasovagal syncope, a reflex that causes fainting. Occasionally, rapid position changes might cause low blood pressure. When you stand up, you may feel lightheaded as gravity pushes blood toward your feet. Orthostatic hypotension is the medical term for this. Diastolic blood pressure. In order to replenish with blood, the heart takes a break in between beats. Diastole is the term for the pause in a heartbeat. The reading taken during this pause before the subsequent heartbeat is your diastolic blood pressure. At calm repose, the normal diastolic blood pressure is under 80 millimeters of mercury. When you are resting quietly, your diastolic blood pressure is often greater if you have high blood pressure. When the diastolic blood pressure is 60 millimeters of mercury or less, it is regarded as dangerously low, and when it is 110 millimeters of mercury or more, it is seen as dangerously high. It may be wise to call your doctor if you consistently get readings with these amounts. Dehydration or significant bleeding may cause low diastolic pressure. It might also occur if the arteries loosen up and enlarge. Stages of high diastolic blood pressure. There are also multiple stages involved in high diastolic blood pressure. Stage 1 hypertension. Stage 1 hypertension is defined as a diastolic blood pressure of 80 to 89, which can be treated with short-term medications and/or dietary modifications. Stage 2 hypertension. Diastolic blood pressure of 90 or greater indicates stage 2 hypertension, which can significantly raise the risk of a heart attack or stroke and necessitate a lengthy treatment regimen. Hypertensive crises. If your diastolic blood pressure is 120 or greater, you are in a hypertensive crisis and need to call your doctor immediately once. If you want to know more about blood pressure, then click the link given in the description below.